Good morning, good afternoon, and good evening all. A very warm welcome on behalf of the IPB events team. We're very much looking forward to supporting you with today's Advocacy to Action webinar, Introduction to Global Eye Health Advocacy. I'm now delighted to hand over to Jess to welcome you to the webinar. Thank you.
Thank you, Debs, and welcome everyone to our very first Advocacy to Action session. This six-part series aims to inspire and support eye health advocates around the world to make the case for universal access to eye health. It's a pivotal time for eye health. Last year, we saw the end of Vision 2020, which guided action across the sector for the last 2 decades. We've also seen the release of the first World Health Organization World Report on Vision, the first Lancet Global Health Commission on eye health, and major commitments at the World Health Assembly and very soon at the Commonwealth and at the United Nations. This provides an unparalleled opportunity for us to persuade national leaders and policymakers about the importance of eye health. And at the same time, as we all know, the problem is only getting bigger and more unequal. So the need for collective advocacy has never been greater. In this session, we're going to be discussing some of these major global commitments and developments and exploring the key strategies we can adopt to translate them into action. I'd like to thank our wonderful sponsors of this series. They have been instrumental in helping to develop and shape this programme, and we have definitely put them to work. You'll see many of them speaking and facilitating throughout the series. Right, so before we get started, we'd like to run a quick poll just to get a sense of who we've got in the audience. Which of the answers below best describes your organisation? So it's great, we've got a real mix across the sector, lots of you joining from international NGOs, but a representation actually across each of the organisations that make up the eye care sector, which is excellent. And we'd also like to get a sense of how much advocacy you undertake in your current role. So can we run our second poll? Great, so again, a real mix across the sector. The most common answer is occasionally, but we have got a lot of people who do it regularly and frequently, so some experienced advocates among us, but also some who've never done any advocacy in their current job. So thank you very much for joining us on this mission. So now I'd like to introduce our first speaker, Caroline Casey. Caroline is the founder of the Valuable 500, which is a campaign to get 500 businesses to include disability as part of their leadership strategies. I had the pleasure of interviewing Caroline last week on her extraordinary work putting disability inclusion on both the business and the global agenda. So over to Caroline. I'm very excited to be joined today by the award-winning social entrepreneur and founder of the Valuable 500, Caroline Casey. Caroline, thank you so much for agreeing to be part of our very first Advocacy to Action session.
It's absolutely fantastic to be with you, and I often think that when I hear how I'm introduced, I think you should just call me a troublemaker. I'm a troublemaker for change. I was like award-winning social entrepreneur. No, she's a troublemaker.
So my first question, Caroline, is what motivates you? What gets you up in the morning? Perhaps a strong coffee and a cup of tea.
I think, yes, coffee is very good, and puppies at the moment get you up very early in the morning. But I've been doing disability business inclusion for 20 years now. And, you know, I think the fire in my belly is even stronger today than it was 20 years ago. I think maybe it's what gets me up today more than any other day is because I really think we're at this extraordinary moment in our history and in our time when we could eradicate the extraordinary disability exclusion crisis that exists. I actually think we can. I think there are some moments in our lifetimes that you can be part of, and I believe that. So that's what gets me up now, is because I can feel this momentum. As of this morning, we're at 451 companies. We only have 49 places left. And that's extraordinary. And for me, why I do the work I do is I truly want every one of us to be able to belong uniquely as ourselves. I want, that's what makes the world, I guess, the beautiful, intriguing, extraordinary place it is. If every one of us can be uniquely ourselves, but be collectively respectful. And we cannot have that unless disability is equally and meaningfully integrated into business. It's just not possible.
And I know that you've had an incredible journey to get to this point, which includes so many things, even an elephant ride across India. I wonder if you could share perhaps with the eye health sector a little bit about how you got to the valuable 500.
When I came out of the closet in Accenture, I wasn't looking after my eyes. Like, I was hiding my eyes. I was working as if I had perfect vision, which it's so ridiculous now, right? It is so ridiculous. But just to give you some context of that, before we launched the Valuable 500, we did some research, and it said 7% of our CEOs have a lived experience of disability, like I did, but 4 out of 5 of them are hiding it, still to this day. So can you still see the huge problem that exists around disability and accepting it? But when I came out of that closet, I was so confused, like, what was I going to be? How was I going to change and adapt? And the doctor I had seen said, look, take some time off. And it was an extraordinary story, because I always remember when I was leaving his office, he said, you know what? I have a funny feeling about you. I have a feeling you're going to do something very different with your life. Now, I was just looking back at him, and I was really not in a good mood, and I was cursing blue language in my head. But when I left his office, I knew something had to change. And it was that day that I decided that I would fulfill my childhood ambition to become Mowgli from the Jungle Book. And 9 months after leaving that doctor's office, I found myself in southern India, on Kappa Beach in Kerala, at the beginning of a 4.5-month trek, where I become Mowgli from the Jungle Book by learning how to become a mahout, or an elephant handler, and going across southern India 1,000 kilometers. But what brings me into relationship with eye health was, because I'm Irish and Catholic and guilty, I couldn't do it for myself alone, no, certainly not then. And I wanted to really do something positive, particularly around blindness in India. And so I had always been donating to Sightsavers as a kid. And I rang up one of the head fundraisers in Sightsavers and said, I'm going to go across India on an elephant. Can I fundraise for cataract operations? And he was like, his name was Russell Richards. And he just was like, okay, yes, okay. And that's how I began my relationship with Sightsavers, which has been a long-standing relationship for many, many years. And it opened my eyes to, the idea that people are blind and they don't need to be. And you must remember, coming out of the closet like that, I had to come to terms with my own disability. But then with my work with Sightsavers, I was like, how are there people in the world that are needlessly blind when we could fix it? You can't fix my sight, but why can't we not? Why would we ever let somebody go blind, particularly when there's a solution? And so that sort of sparked a whole kind of energy in me, and we raised enough money to pay for 6,000 cataract operations.
Oh, fantastic. So if we move to the Valuable 500 and your experience there, I mean, I think one of the things that we can really learn from you, Caroline, as a sector is advocating to different change makers. So as you know, we're starting to reframe eye health as a global development issue, which means that we need to persuade, global leaders that eye health is not just important for any national health system, but it's hugely beneficial to education, to work, to the economy. And that means that we're going to have to shift and change the way that we advocate and who we advocate to, not just to governments, to ministries of health. And so I wondered if there are, what experience you can share from advocating to business leaders. Are there lessons learned that we can take from that model?
The scale of these issues cannot be resolved by governments and foundations and NGOs and charities alone. It just can't. The most powerful force on the planet is business. And business affects the way society behaves. What business values and invests in, society will value and invest in it. And so what we would say is that an inclusive business system and a fair business system will create an inclusive and fair society. So the only thing that I can say to anybody in trying to break new ground is we have to accept people where they're at and not blame them and not cancel them and not shame them, you know, because there's a great expression, how's right working out for you? It's not enough for us to be right. Okay, so we've got to find a way to invite them into the space that they feel comfortable to admit they don't know or that they haven't done enough, so that we can help them move forward. The second piece is when we've dealt with CEOs, we take them as human beings, right? Like they are moms and dads and sisters and brothers and all of the other things, is to take, the science is really important, okay? The stats are really important, but it's also the importance of the story in the human being. You've got to approach, when you talk to business, about the duality of this, the business opportunity of it, as well as the human opportunity. And one of the things that I've always been saying is, wouldn't it be amazing if we got all of the CEOs in the world and all the government leaders just to take off their glasses for 24 hours and say, now seriously, wouldn't have been able to do their job. So they wouldn't have reached their potential. And so I think there's lots of ways in which we can actually make that human connection. But the third thing, there is no doubt, it is around the business case. It is around productivity. It is around profitability. And look, how many people are in a workforce? We know that 80% of disability is invisible. I am sure there are endless amounts of people who have eye conditions that have not been diagnosed, therefore they're not performing at their very best. When I was in Accenture pretending I had 20/20 vision, I mean, I nearly broke myself in two trying to keep up. Imagine that I'd had the help. How much better would I have been at my job? How much better would I have turned up? And so there is a very large value chain conversation for business leaders, but also I truly believe business leaders are human beings first, and they have families. And I don't think anybody would want anybody to be needlessly blind, because something around sight touches all of us very, very deeply. It's a very emotional thing. So it's bringing the combination of the stats and the stories and the inconceivable idea that people are blind when they don't need to be.
I wanted to move now to sort of forms of advocacy, because much of our advocacy at IPB certainly has really focused on getting global commitments at some of the major international institutions, and we've focused at the World Health Assembly and at the United Nations General Assembly. And I know that you, for example, launched the Valuable 500 at the World Economic Forum, which is just amazing. And you also managed to get disability inclusion on the agenda of Davos for the first time ever. So what's your experience of using different forums and events for advocacy? What's been most useful, and how do you decide, what's going to have the most impact?
For me, advocacy, and I'm going to call it hustling, because it's what I feel like I hustle for a living, is I can't even tell you at the moment, even in COVID, I'm doing anything between 13 to 20 gigs a week. And that can be on a panel. It can be, by the way, this is on Zoom. It can be on a big event with thousands of people. It can be in a room with 3 people. But every single conversation that I have, I imagine it is the most influential person in the world. Because advocacy is at every level. It's at the powerful CEO level or the ministers, but do never underestimate joining the dots at ground or grassroots level, dialing up that voice. Because if you look at business for a second, people forget, yes, the Valuable 500 is talking to the 500 CEOs. But remember, those 500 CEOs represent 20 million employees, okay? 20 million employees. They're equally as important to get excited, because they ask the question, they encourage the business to listen. Okay, that's 20 million employees. But then let's just think about the value chain. Who supplies these companies? Who cleans these companies? Who do they work with? Supply chains, we're into the billions. So every conversation as an advocate or as a hustler, don't put a hierarchy into them. They're all important. And there is no one way for us to resolve this issue, because it eye health affects every single aspect of society in every single way. So every single conversation is of value, and it's about how we add them up. Yes, the visible Davos conversations are brilliant, but there have been rooms where there were 3 people that I underestimated, and that has driven more change than I could ever have imagined.
Thanks, Caroline. And perhaps if I just have my final question to you, which is, if you could distill all the amazing advice that you've given to us over the last sort of 10 minutes or so, what would be your kind of top tips, your advice to the eye health sector on influencing, positive change?
Well, I think I'm going to just say what my heart feels. There are 1 billion people who could see, and there is a solution, and it's possible. And the only thing that gets in the way of any of this is intention and will. And I think anybody who works in this area, you're carrying around something that can change. And I guess for any of us who do this big change work, don't be despondent if it doesn't land once. Don't take the failure personally, because it's so hard not to. But it's about, you're never defined by the last conversation, because you get to have another one and another one again. And I think this time is, how do we get that balance between being unapologetically confident that we have a solution, that this is an extraordinary opportunity, not just for eye health, but for the global potential of our humanity, because this touches all of us. Have confidence in the story that you have. If you don't succeed once, try and try again. And that thing about sustainable grit is make sure that you're resourcing yourself up all the time for when the disappointment comes, because always on the other side of disappointment, and I live this to this day, is that light. And I often will kind of say is when, I can never be more sure of something, that when something has failed, on the other side of the failure has been my greatest success, hence with the valuable 500. What the work that we're doing, all of us are doing together, it is exciting, and the time is here now, and we just have to use it well and right.
Thank you, Caroline. Well, that has been hugely inspiring, so rich and full, and such wonderful advice to the sector. So thank you so much for being part of our first Advocacy to Action session. So that was Caroline Casey, everyone. Hope that she's motivated all of you to become hustlers for eye health advocacy, as she puts it. We were only able to share just a small section of the interview today. I got partly carried away asking Caroline so many questions, but the full interview will be available on the Advocacy to Action pages after this session. So please do go and watch the full interview. Next, I'd like to introduce Brandon Etong. Brandon is the Head of Public Policy and Advocacy at the Fred Hollows Foundation and has over 15 years of experience working in various advocacy roles, including as Director of Advocacy at Vision 2020 Australia. He has been instrumental in the achievement of some of these major global commitments at the WHO and the UN, and I know works tirelessly in the pursuit of eye health for all. Brandon is going to give us an overview of the global and political landscape for eye health for the next decade. But before he does, we'd like to run another poll just to check that you're all still with us and awake, to find out what you think the greatest challenges are for eye health advocacy for the next decade. So what have we got? So the number one choice, the number one challenge is inadequate government prioritization. So Brandon, perhaps your presentation will give us a little bit of optimism on how to tackle that challenge.
Thanks so much, Jess. And I have to say, I've done a few of these things and never had to follow a troublemaking Mowgli before, so that's a new experience. Thanks so much for the invitation, Jess, and I'm really happy to be here. When I was thinking about this first session for the Advocacy to Action series. It sort of reminded me back in my days at an undergraduate level, studying social science and policy, and what we sort of learned about what you need for meaningful systemic change. And the first step being to properly diagnose the problem at the heart of an issue, and that how we speak about a problem directly influences the types of solutions that are available to us. Now, at the time, we were studying an approach by someone by the name of Carol Barchi, from an academic from Adelaide, who had this idea around a what's the problem represented to be approach, or a what's the problem approach. And I sort of got thinking about the environmental movement. We used to talk about global warming. We used to think about global warming as the issue that evolved then into talking about climate change, which is probably a more full expression of the climate science. But now you see emerging another sort of frame, which is around climate emergency or climate crisis, which is about trying to not just talk about the subject of the matter, but also putting into that frame the action and the urgency of that action into how we talk about that topic. Now, in eye health, I feel we've also gone through an evolution in our understanding of our issue. The problem at the heart of blindness and vision impairment, at the heart of our community, and the solution options available to us that can affect change. Now, because we've got short time, taking a timeline approach today, I'd like to briefly take stock of where we find ourselves today, the new agenda set before us, and then to touch on the role of advocacy in taking this agenda forward for the next decade to 2030. So firstly, though, what is the problem? Now, if we look at the past 2 decades under Vision 2020 and the Global Action Plan on Universal Eye Health, perhaps the most powerful outcome is the demonstration of when we speak with a single voice, have clarity of purpose and a common language, we can really start to generate attention on eye health. The creation of prevention of blindness committees, national eye health plans, and indicators for measuring progress have all helped to gain some focus of policymakers and donors on eye health. Of course, there are still significant challenges that still remain, challenges that can be illustrated really by sort of 2 key stats that have come out in the 2020 Global Burden of Disease report put out by the Vision Loss Expert Group. And I would say that those 2 stats are, we have 1.1 billion people today living with vision impairment or blindness that could have been prevented or is yet to be addressed. And the second one is that the number of people living with blindness or severe vision impairment will double by 2050 on current projections. So there's a lot of people now, and there's going to be even more going into the future. Building on that, in 2019, you would have heard of the WHO World Report on Vision, said that the key challenges that remain before us are around inequities in access, fragmented services that are poorly integrated into health systems and coordinated with other health areas, insufficient and uncoordinated workforce, lack of resources and financial protection, gaps in data, and a lack of political will to take action as a priority within broader public policy. Now, the World Report on Vision as a solution puts forward 5 key recommendations, but ultimately its key thrust is to make eye health part of universal health coverage through the implementation of integrated, people-centered eye care across the continuum of health promotion, prevention, treatment, and vision rehabilitation. Now, IPEC, or Integrated People-Centered Eye Care, has 4 key strategies as put forward in the World Report on Vision. The first is about empowering and engaging people and communities. So, making sure that services are close to where people live. The second is around reorienting the model of care towards primary and community care. The third is around coordinating services within and across sectors. And fourth, in creating an enabling environment, particularly in relation to inclusion of eye care within national health strategic plans, around eye care integration in health information systems, and planning the eye health workforce according to population needs. Now, when we step forward into 2020, we see the next progression, next step in this evolution. We see that the 194 members of the World Health Assembly, which are country governments around the world, have actually taken the next step in putting forth those recommendations in a clear and systematic way. So it does three things, this resolution. It says that countries will commit to implementing the recommendations of the World Report on Vision. It calls for targets to be developed so that we can actually monitor our progress. And it starts to expand in a formal sense eye health as a development issue. So the World Report on Vision talks about eye health, squarely within health and well-being, but also goes further in the resolution to talk about eye health within poverty, education, gender, inequality, employment, and so on. Now, of course, we can't forget COVID-19 in 2020. And the one thing I would say about COVID is, if we think about our space in public health, hopefully we will never need to make the case again in linking health and people's health and public health with the economy. Hopefully we'll never need to make that case again. Stepping into 2021, look, I think there are three big things happening this year. The first thing is the resolution last year asked the WHO to go away and develop targets with member states. WHO did that. They have passed those targets through the WHO Executive Board, and hopefully next month at the World Health Assembly, those global targets will be adopted. And they're around the effective coverage of cataract surgery and refractive correction. And we know the effective part of coverage is about coverage and quality. The second, many of you would have heard about the release of the Lancet Health Commission on Global Eye Health that was released in February, which does many different things. I'm sure many of you have taken the journey and the plunge into the Lancet already. It talks about the broad importance of eye health. It talks about the scale of the challenge. It talks about the economics of vision. It talks about the research needed. And finally, looking beyond 2020, it talks about delivering high quality eye care for all. But its central message is about eye health needs to be reframed as a development issue and is essential to achieve the SDGs, and unpacks that in a really systematic way. And the Lancet does two things. It gives us evidence-based and it gives us credibility in our message. And the third thing is, and you've probably heard about this as well, we are hoping to have, with thanks to the co-chairs of the UN Friends of Vision group, the first eye health resolution at the UN General Assembly. And the IPB is taking great leadership here, and of course the co-chairs, and that really takes forward the narrative of eye health as a development issue. Hopefully we will see in that resolution a clear narrative that makes that link. Hopefully we'll see an ask of UN agencies to take specific steps towards integrating eye health into their programs, and hopefully we'll see a call for eye health to be included within the SDG monitoring framework. So let's see how that unfolds this year. So just what does all this mean from an advocacy perspective? Coming back to this, what's the problem approach? From an advocacy perspective, I'd highlight really four key concepts. If you get nothing, get these four concepts. Eye health needs to be part of universal health coverage. Eye care needs to be integrated and people-centered. To count, eye care needs to be counted, so we need to monitor our progress against clear global targets. And combined with the above, eye health needs to be part of the mainstream agenda to achieve sustainable development for all and leaving no one behind. So over the course of the next decade, advocacy and advocates will need to take on the responsibility to drive this agenda, to influence the right decision makers, to forge the relationships with the right partners and coalitions, to harness the power of data and evidence, to be bold in stepping forward, always with respect, but without apology for our tenacity and our passion, which is something that Caroline mentioned before as well. And to generate public support to shift the minds of the masses and those in power towards understanding the importance of eye health. Now, how we do this will be the subject, I think, of this Advocacy to Action series, and I'd really like to thank the IPB for the tremendous leadership and helping guide us forward. So really looking forward to seeing how the how part gets unpacked throughout the next 5 sessions. Now, I'd like to end by saying that, I'm really excited by the challenge ahead, building on our successes in the sector, but in taking eye health to a whole new level so that ultimately everyone everywhere has access to quality eye health services, and that everyone living with blindness or vision impairment are empowered to live their lives to the full. Back to you, Jess. Thanks.
Thank you, Brandon, and thank you for setting out such a clear roadmap for the next decade. Let's start to unpack a little bit of the how in our next presentation, because we have Elise Mu, who's the Global Research Coordinator and Project Manager at the Fred Hollows Foundation. And Elise is going to share with us Fred Hollows' experience of translating some of these initiatives that we've just heard about, such as integrated people-centered eye care, to the national level in the Philippines and Ethiopia. So Elise, over to you.
Thank you so much, Jessica, and thank you again to the IAPB for organising this important forum for us to share learnings, even though we're early in the stages of this project. So I've only got 5 minutes to try and summarise quite comprehensive, complex project. So forgive me for rushing through things a little, but I look forward to your questions later on during the session. So next slide, please. Advancing Integrated People-Centred Eye Care is a 3-year project supported by the Australian Government to translate the global eye health agenda, which Brandon just synthesised so well, into national action. We plan to do this by supporting governments in Ethiopia and the Philippines to embed IPEC strategies in national health systems and plans, and to also ensure we're embedding those strategies and approaches within the Fred Hollows Foundation's broader programming and advocacy frameworks. And finally, we want to ensure we are sharing lessons learned and resources to support global implementation and rollout of IPEC. So there are 3 key streams of work. First is a systematic review and revision of our internal data. So policies, plans, systems, guidelines that we've amassed over the last 25 or almost 30 years of working in the eye care sector to identify opportunities to embed IPEC as part of our business as usual. So we're doing this through some literature review work, a desk-based review of our own programming, and some internal capacity building. The next stream is the largest and probably the focus for this discussion, which is to support governments in Ethiopia and the Philippines to understand IPEC and align relevant plans, programs, and services. So this includes working with the Ministries of Health, other eye health organisations, World Health Organization, and Prevention of Blindness committees to implement World Health Organization technical tools that have been developed to support IPEC, such as the updated EXAT, rolling out some training and capacity building resources for IPEC, and workshops with national and provincial staff to interpret and really delve into the recommendations and data that are coming out of the EXAT and develop pilot projects in response. So it's the largest stream of work, and it's really trying to take all of the information that's available around IPEC, as well as some national data to identify appropriate recommendations and plans. And finally, we want to generate and share learnings to support broader implementation of IPEC. So this is partly what we're doing now, engaging in international and local presentations, and we look forward to continuing to work closely with IAPB. Next slide, please. So it's very early days. We've only just commenced this project in 2021, but there are some obvious and not so obvious learnings that are already emerging. So firstly, having a project design and budget that allows for resourcing of a local project team has been critical. It's pretty self-explanatory, but having dedicated resources in terms of local staff and funding to progress advocacy on the ground and develop those critical relationships with decision makers and local stakeholders has been a vital first step for us getting this project set up. Emphasising the World Health Assembly resolution and member states' commitments has also been an important step to both underscore accountability and also showcase how ministries can demonstrate leadership at regional and global forums to really incentivise them to engage with this work. And similarly, we were actually able to reference the World Health Assembly resolution in our advocacy to the Australian government for funding to support this project. So it's been a really important mobilising framework, both for policy, but also resourcing. Analysing the strength of existing eye health programs for alignment with IPEC has also been a critical step. So we know that there are lots of programs and interventions that already align with IPEC. And rather than reinventing the wheel, we want to be able to document and build off these successes. A good example in the Philippines has been the community eye health programs, which incorporate many of the approaches recommended by IPEC. So we're working to strengthen, analyse key components and expand this model into other provinces as part of this program to better align with IPEC. Related to this is identifying and aligning with national priorities and opportunities to integrate eye health into other healthcare frameworks. So we know this is a key recommendation coming out of the World Report and more recently the Lancet Commission. And we all agree that integrating eye health into other sectors is important. But what we need to do is invest in understanding what are those windows, what are the opportunities for catalysing integration and identifying strategies to support associated changes in policies, plans, guidelines, etc. We know we've done this well in some aspects of eye care, so I think diabetes and work to integrate diabetic retinopathy into broader NCD systems is a great example, and hence we're investing in situational analysis and mapping to identify those opportunities to inform this program of work. And finally, it's a well-known fact of advocacy that leveraging stakeholder networks and working in coalitions is key to success, but I think it cannot be underestimated. We're stronger and more effective when we coordinate, share learnings, and present a united front rather than approaching governments or decision makers individually. We've got lots of examples, the International Coalition for Trachoma Control being a really prominent one where the eye sector has done this well. So how do we translate that into other aspects of eye care? So thank you. Sorry again to rush through that, but I really look forward to discussing these, our learnings and future challenges as part of the Q&A. Back to you, Jess.
Thank you, Elise, and thank you for sharing some of that early learning that you've had at Fred Hollows Foundation. It's great to hear these projects taking hold. So we're going to move on now to our panel discussion to unpack some of what we just heard. Can I encourage all of you to post your questions in the Q&A box, and then I will put those to our panelists. So we're joined on our panel today by Dr. Jambi Garap, and Dr. Jambi is an ophthalmologist in Papua New Guinea who has almost 30 years experience in the sector. She is the president of the National Prevention of Blindness Committee and has recently joined the University of Papua New Guinea as a lecturer in ophthalmology, a newly created position at the university following the advocacy efforts of the National Prevention of Blindness Committee. So welcome, Dr. Jambi. And we're also joined by Jorg Jenevine, who's the Global Head of Public Affairs for Ophthalmology at Novartis. Jorg has 20 years of experience in public affairs and policy, working at both the European Parliament and within pharmaceutical companies. Welcome, Jorg. And we're also joined on our panel by Brandon and Elise. So welcome, everyone. Dr. Jambi, perhaps I can start with you, because the National Prevention of Blindness Committee in Papua New Guinea, which you helped establish in 2012, has been very effective in advocating for national change. Could you share some of its major advocacy successes and what's been the key behind those successes?
Good evening. Good evening, everyone from Papua New Guinea. Yes, we've had a lot of successes from the effort of the National Prevention of Blindness Committee since it was established in 2012 as a result of encouragement from the Western Pacific region chair at the time, which was Richard Lemesurier. Before the Prevention of Blindness Committee was formed, we had all our stakeholders, NGOs, and the government working in their own isolated areas. But with the formation and establishment of the PBL, everybody got together, and there's a lot more collaboration, and we are not competing with each other, sort of complementing the work that has been happening. So some of the success stories of the PBL has been, one of them is the position that I'm occupying now. 4 years ago, CBM supported our advocacy to get the university to recognize the importance of getting a lecturer within the University of PNG to be able to be solely committed to training ophthalmologists in the country. So 4 years after, that was 2 years ago, the university then created a position, a local position that I am now occupying. The other advocacy that has happened is the national, this is the only clinical discipline that has a national eye health plan that has been able to achieve some of the addressing with the Vision 2020 efforts that has been going on before in the last 20 years, and also supporting some of the work that has been advising the government on the global action plan, the resolutions that has been going on. We have been able to advise government when they to vote for the changes that we have seen. We are seeing so far, and then we've now in the last 3 years done the rapid assessment of avoidable blindness that has been able to give us evidence to show that we have a lot of our incidence, our prevalence of blindness is really high within the region, and the government needs to take stock of that. So there have been some of the main events that has been going on in our country. The other major changes that we have seen is the effort of our stakeholders, Brian Alden Foundation and others that have approached Lions International that has now given us a national research center for eye health, where a lot of the training is happening for the ophthalmologists in the country. So a lot of good things have come out of that. One of the other major things that has happened is, being able to hold our meetings consistently and getting all the stakeholders to work together to achieve what is written out in our national health plan, and supporting the chief ophthalmologist to be able to deliver the things that have been outlined in the health plan. We were lucky to engage the health minister when we launched the World Report on Vision launch last year, and I think that event on its own was able to attract the health ministers to see the importance of eye health and to fast track some of the signing of documents that needed the Center of Excellence to be the signing process to happen and things like that. So that has been some of our major efforts of the National Prevention of Blindness Committee.
Thank you, Dr. Jambi. And well, you've certainly been busy over the last few years, but it's great to see that the World Report on Vision is being used as an impetus for change, and that collective advocacy and coordinated advocacy has been central to your success. And one of the things actually that we learnt from the poll earlier is that the key challenge that people feel for eye health advocacy is around obtaining that government prioritization or that government commitment, and obviously critical to that is government ownership. Elise, what's been your experience of collaborating and engaging with governments on your IPEC project in the Philippines and Ethiopia?
Thanks, Jess, and thanks, Dr. Day. It's great to hear of your experience in Papua New Guinea. So we selected the Philippines and Ethiopia very intentionally due to the strength of relationships with ministries of health and our country teams in both countries, and the fact that there were existing governance systems for managing eye health, such as through prevention of blindness committees. We've also tried to emphasise that IPEC, although it's a new way for the eye care sector to frame eye care across the spectrum of need, it's not necessarily new in practice. There's lots of initiatives on the ground to engage communities and address equity, to improve primary eye care, to create an enabling environment. So trying to emphasise the successes and progress that governments have made, and then looking at areas for improvement. But at the same time, we've encountered difficulties. We know that eye care is often poorly integrated into health systems and managed as a standalone issue. And so we've tried to highlight how IPEC gives us a new framework and opportunities to better integrate, but also look at, well, what are the specific policy opportunities? So, for example, in the Philippines, there's a Universal Healthcare Act and a law that's been introduced. So really doing the work to understand what that means, and then identify how eye care might be integrated and framed as part of that. And then finally, what I would say is COVID is, of course, another challenge. Brandon touched on it before. And as you said, Brandon, it's drawn attention to the importance of that and value of high quality universal healthcare systems and services. But it's also meant that the World Health Organization and ministries are understandably stretched and will continue to be to manage vaccine rollouts and COVID recovery. So I guess we just have to be a little bit realistic and patient about how much bandwidth we can really get for eye health at the moment.
Thanks, Elise. And I suppose on that COVID point, it's obviously going to have an impact on our advocacy. I mean, the fact that we're all sitting here on Zoom today just demonstrates, the change that it's had to both our lives, but also our approach to work. Brandon, I wonder if you could share your thoughts about, what you think the impact of COVID is going to be on the sort of policy and advocacy landscape for eye health. As Elise said, it's had a devastating impact on health systems and on eye care, and there's a risk that we just fall further down the priority list.
Yeah, absolutely. And this is such a great conversation, and there's so many threads that just keep popping up throughout the conversation so far. And again, thanks Elise and Dr. Johnny for sharing. Look, I think we are in a global pandemic. So, and as Elise said, that we need to not understate the impact. We know that services have been postponed, pushed back, called non-essential services, all these sorts of things. Wait lists are getting longer and those sorts of things around eye care services, cataract surgeries, access to glasses and those sorts of things. So we know that then there are going to be real impacts on eye care around the world. But I'm optimistic to think that there's also a great opportunity here. Again, because health, universal health coverage, strong, resilient health systems is so squarely in the frame, and also reaching across sectors to help to roll out vaccines, to provide PPE, personal protective equipment, all those sorts of things. There is so much happening that may not have happened before. So I think that there's an opportunity here for eye health to think of new ways of engaging sectors we may not have engaged before. I think we need to be realistic about timeframes, as sort of Ellie said, in terms of being patient. But I think that we have an opportunity to think a bit differently, to talk to people we don't necessarily talk to, and then to sort of think outside the box a little bit. It's going to take some time for this whole COVID issue to unpack, but I think that we can start where we are now and take the steps forward.
Thanks, Brandon. And Jorg, I wonder whether I could bring you in here, because we heard from Caroline earlier about the importance of bringing business leaders along with us, and we've heard from Dr. Jambi, how important it is to get the whole sector behind the eye health advocacy messages. So what do you see the role of the private sector being in our effort towards universal access to eye care?
Thank you, Jess, and thanks everyone. I think it's a very good question. For me, the role of the private industry is actually to be part of this bigger efforts to promote eye care. So it's very often that I think there's a perception because the industry is on the one side and civil society is on the other side. And then there's maybe the government that we both want to lobby or hassle. I like the word. I think I will continue to use that word. But what I truly believe is that we can only achieve change if we all work together, because in the end, we all want to achieve the same goal. If you look at the products that the pharmaceutical industry brings forward, it is actually about improving patients' lives. And the civil society wants to achieve the same thing. So we need to work together in hassling the governments to make eye care a priority. And I think it only works if we come together, because I've seen this in the questions before, that there's I think especially in the eye care sector, sometimes there is a we're not always aligned as we should be, and we don't have the joint messaging. And if we continue to actually separate ourselves, we're only going to make our position weak instead of stronger.
Thanks, Jorg, and I completely agree. I want us to move us now to some of the shifts that we're starting to make in our advocacy approach to eye health. Elise, I wonder if you could share your thoughts from the IPEC project. How have you shifted your approach to advocacy when you've been doing IPEC in Ethiopia and the Philippines?
Oh, well, I can only speak from my experience in this project, but I was previously working in the Fred Hollows Foundation's global advocacy team. And I think an important aspect of this project has been presenting it and planning it as a coordinated programming, research and advocacy initiative, rather than managing advocacy as a standalone activity that might come at the end of the project when we've got findings and we want to go out and advocate to government to implement them. Having it be intentionally resourced and incorporated throughout the cycle of planning, evaluation, implementation, and budgeting has been really critical. We know that advocacy occurs at all different levels of organisations and in different ways, but again, really embedding it within our work and within our programs, which already happens in a lot of ways. I think that this project has been quite a unique example, though, just because we've really called that out from the outset. And I think we've witnessed lots of work and success within the eye health sector, especially through IAPB, to advocate for a new global agenda for eye health. So we've got the World Report, we've got the WHA resolutions, we've got IPEC, we've got evidence through the Lancet Commission. So we have the frameworks, but we need to now enable and support both program implementers, governments, eye health practitioners, and decision makers to understand what these frameworks mean for them in their context, as Jorg was saying, have some common messages and practical recommendations that they can then use to implement those strategies in their context.
Thank you, Elise. And Dr. Jambi, could I bring you back in? Because we've talked a lot about the kind of global developments, the global commitments that have been made at the World Health Assembly and now at the United Nations. And I know that you had the launch of the World Report on Vision last year. I mean, do you think that these developments that happen at a global level make a difference to your national advocacy? Oh, I think, Dr. Jambi, can you hear us? We may have, oh, there we go.
I think it has made a big difference. It's those sort of events. Yeah, I can. Can you hear me?
We can hear you, Dr. Jambi, yes.
Yeah. Okay now?
Yes.
Yeah. Am I okay to start?
Yes, we can hear you. Go ahead.
So yes. So during the launch of the World Report on Vision, we were able to attract the Minister for Health to attend this session. There have been other events that we would normally not have any representative from the government attending, but this time we had the minister attend, and we were able to address most of the issues that we faced. And I think that he got the message. He heard what we were all about. We were telling him that we had the rapid assessment of avoidable blindness. We had evidence to show that our prevalence of blindness rate was 5.6%, and the two most commonest causes of blindness is a pair of reading glasses and a cataract surgery, and and the disparities between we have only 12 to 14 doctors who are in attending to the 9 million people that we have. The problems with consumables and infrastructure, and all those issues were presented to him at that time. And at about that time as well, he wanted to know what we were planning, and we mentioned that we needed that Fred Ollos Foundation, New Zealand, was looking at building a center of excellence. So we are building on that, and he mentioned, what is your problem? And we said, we're waiting for the government to give us the land. We've identified the land and we need it cleared. So that sort of fast tracked when his attendance managed to fast track the land issues, identifying where the land was that the Center of Excellence would be built on, and then later on we were able to push in papers for him to sign, and he knew exactly where the problems were. Emerging problems like diabetes and events, the World Sight Day messages that come from IAPB, and the government going on to the SHOGM meetings and things like that, when we give in the information, and the information and the prompting, the targets that are set by IAPB and WHO to advise people on the ground, like the National Prevention of Blindness Committee and NGOs, and the chief ophthalmologist and people like that are able to then prepare the documents that's needed for government support. And once those papers are signed, then we can, on the ground, can use those evidence, those support to say that here you are, you signed for this, and we'd like you to, to stand by the word that you've given, that you would support eye care services and things like that. So that has been a big boost for us in Papua New Guinea.
That's great. It's great to hear that you are able to use those commitments in your national advocacy, and that you're able to hold governments to account to those global commitments. I wonder, Jorg, if we could touch then at the kind of regional level, because quite often regional institutions also have a pretty significant role in both helping to shape but also set policy for countries. And you've done a lot of work, I know, in Europe. So in a region as diverse as Europe, what do you see as the value of advocating to the regional institutions?
Thanks, Jess. So I'm clearly a Europhile, and I know we have a lot of Anglophones around here, but I'm going to continue my Europhile approach. I think for Europe, which maybe serves as an example here, yes, a lot of decisions are still made at the national level, but the regional level, so the EU in that part, is actually the trendsetter. This is where everybody comes together, where all the data is actually being collected, and where new decisions, while not being the executive decisions, but the overall decisions on where do we go are being made. Also at the regional level, I think you can, what they call best practice sharing, and I always like to actually call it name and shame, because you can actually pull out certain countries that do exceptionally well, and then approach other countries to say, why aren't you doing as well as other countries? So I think the regional level is really important for the overall policy development, but what should not be forgotten is that obviously you need to then also translate it down to the national or the even more smaller regional level where the actual decisions are being made for patients.
Thanks, Jorg. And Brandon, I wonder if you have any thoughts on how we translate what's happening both at the UN and the WHO, but also at some of the regional institutions down to the national level.
Yeah, I mean, we've had so much come out particularly from Jorg just then, but also Dr. Jambi, and Dr. Jambi's example really spoke to what Caroline was saying earlier about have a dialogue, open that dialogue, and see where that conversation goes. There'll be more than one. And Dr. Jambi, you said that there was, you had that Word Upon Vision launch, you talked about the Centre of Excellence, and he said to you, what is the problem? And you came and you said, well, we need the land. That relationship and that dialogue is so critical. So look, just to answer your question, Jess, I think, not to get technical, but I think there's probably four key things. And look, these resolutions are nothing else other than your license to actually speak to governments about their commitments. That's what they do. It gives you the right to open up a conversation and a dialogue on the topic of those resolutions. So the second thing is, I think we have, and the Word Upon Vision provides a, for lack of a better term, a strategic framework to situate the movement going forward and what needs to happen. It talks about UAC and IPEC and those sorts of things. But the WHO themselves are also producing a whole host of technical tools, which I'm sure a lot of you have also heard about, and we hear about over the next few months as well. So there's a second piece of this technical framework, which is there for you to draw upon, understand, and put together a roadmap for yourselves. The third thing, I think, is talk to your friends. Talk to your friends, talk to the prevention of blindness committees, open that conversation, open that dialogue, using those tools, using the conversations, and see where the gaps might lie and where you might have strengths. And then probably the last, very high level point is in picking up on Jorg's point, which is maybe be bold and think about talking to somebody different. Be bold in looking at sectors that you may not have spoken to before. Talk to the private sector, talk to others, and then see where they may be able to come in, support you, and at least talked earlier on about the unity of voice. So I think that's it's a really important point as well. I think that's probably, I'll leave it at that high level there, Jess.
Great, thanks, Brandon. And so we're going to move now to our audience Q&A, and we've had some questions come through, so I'm going to direct them to our panelists. But if I can start with Dr. Jambi, we saw obviously from our poll that we had a few people in the audience who've not had any experience of advocacy previously. So let's say that I'm not an advocacy specialist, perhaps I'm an academic or an eye care professional, but I want to get involved. Where do I start?
That's a very good question. Yes, so yes, I'm not a public health person. I'm a clinical person, but to start working in a clinic, we need to get established. So when I look at myself and as an ophthalmologist, I see that I'm the leader in the eye health sector, and so I have to make the decision to say that I am the person that will need to be the agent of change in my country or in my provincial setting, if it is a small setting. Then you try to see who else has got the same who's got the same priority or same initiative, who's willing to to be the agent of change as well, and as the same agenda as you, and then we would address the situation. So I mean, as we said before, go and work it with your PBL or whoever, which other NGOs that are there that has the same interest as you. Then you would begin to try to address the problem that is at end.
Thank you, Dr. Jambi.
And the other thing, sorry. Yeah, yes, and the other thing is also, as we mentioned, coming up, you need to show that you have evidence to show that you do have a problem, and you've got evidence to prove that the government needs to step in and help you there. So yeah, and I think that's it. We need evidence, and you need the willpower to go that extra step. And you also need to know that when you start to do the advocacy, some of the times it's you're working out of using your own time and using your own resources as well to make that difference for the situation that you are in, or in your country, or in your province, or in whichever setting that you are in.
Thank you, Dr. Jambi. Some really good words of advice. And actually, fortunately, our next session, which I'll explain at the end, is focused on building that evidence case. But I hope that we can create, a network throughout this series of like-minded advocates that can reach out to one another. We have a lot of questions around this point of obtaining government kind of prioritization of eye health as an issue. And Jorg, I know you spent a little bit of time on the inside at the European Parliament on the Health Committee. I wonder if you could share your thoughts about what proved most effective in influencing government decisions.
Thanks, Jess. I think just to Dr. Jambi's point before I jump into, I had a few written points. Evidence is absolutely important, and it is the basis of what we do. But as Carolyn said at the beginning, hassling or advocacy is also at the personal level. So there's no use of actually really good evidence if you don't manage to get through the door. So don't forget that there is a personal level that you need to pay attention to. And I think this is also what Carolyn said at the beginning. Advocacy is at every level. Don't be hierarchical. I've seen this where people only want to talk to the health minister and they ignore the staffers, and then they totally forget that actually the staffers are the ones that are preparing documents. So I've been, as you said, I've been on the side. I've been hassled, and I've been hassling for quite some time. So I know how this can go wrong. And if you ignore the staffer, or even if you just ignore the assistant, you might actually never get your foot through that door again. So I think that's very important. The other thing that I felt is, and COVID is actually a very good example for this. While we're obviously passionate about what we do, there's lots of other people who are passionate about what they do. And by just proclaiming what we do is the most important thing and ignoring everyone else's problems, we're not becoming very credible. So I think we need to acknowledge that there are other issues, and then we need to actually argue why we think right now is the time for eye care and vision health to be a priority. And we have very good evidence. And I think IPB did a very good job in providing with us with all those documents. One other point I've seen that was really striking to me is never talk badly about other parts of the government. They talk to each other, and also even politicians from very opposing political views will still talk to each other. And once we know, or they know, that you badmouthed about somebody else, you just lost your credibility. So I think you just always be honest and be straightforward, and don't badmouth about anyone else. And finally, I think politicians, they're, they are still, they have to work with their constituents. So is there anything that we can do and help them to help with their constituents? Is there a simple story we can help them to get out why actually their engagement in eye healthcare is important to their constituents? So it's very simple things, but I think if you follow those steps, it should be fine.
Thank you very much, Jorg, and very good words of advice on not bad-mouthing other parts of the government because they speak to one another. We'll take note of that. We've got a question here, which I think actually leads on quite nicely around, how we ensure that the global advocacy strategies that we produce really respond to both the global needs, but also the needs of the individual and the needs of that country that you're advocating in. Brandon, I wonder if I could direct that question to you. When you're developing a strategy, how do you think about those questions?
Yeah, terrific question, which doesn't have necessarily a simple answer, but let me put it this way. I think in the work that we've been doing over the last few years in advocating for, shaping the World Report on Vision, the World Health Assembly resolution, I like to think that we have drawn upon the experience for us at the Fred Hollows Foundation, what's happening on the ground, and others like Site Savers and others in the coalition, and bringing that information and feeding it up into what we are hoping to see in those resolutions going forward. And one of the things we also try to do is bring the voice of those working in country into discussions. So, for example, at the UN Friends group meetings, there's always somebody from working on the ground in those sessions that are trying to provide that voice, so that it becomes tangible. And just sort of circling back to the question we've just been talking about, how do you get the ear of politicians or policymakers? They want to hear the stories of what actually means to their constituents, as you all just said. And I just wanted to pick up on one last quick point on the last question as well. Decision makers don't just want to hear problems; they want you to come with solutions. So, although I started out my presentation earlier about talking about what's the problem approach, but that's a way of thinking through the policy solutions. So to think of what come to the door, definitely put your problem on the table, but also come with a solution, and be open to dialogue, be open to compromise around that solution. Hopefully that's an okay answer there, Jess.
Yeah, that's perfect, Brandon. And we're fortunate because, as a health and development issue, we do have a lot of the solutions, and we do have, quite a simple advocacy message, which does prove useful when we're looking to persuade governments and policymakers. We have a question here, and I'm going to direct it to Elise, because we know this question actually is directed around Nepal, but in fact it's applicable to a lot of countries. The eye care system is often both driven and delivered by the NGO community, and that can be a problem when we're looking to obtain government ownership of eye care. So how do we position our advocacy efforts on eye health to really shift that focus to the kind of government approach? Are there lessons that you can share, perhaps from your projects that you're doing at the moment, Elise?
Sure, it's a super complex but important and interesting issue around sustainability, and it's to kind of broader issues around development and the practice of NGOs in a range of sectors. But I think particularly with this project, because we have been working in these countries for a long time as NGOs and in partnership with other NGOs, we have really strengthened relationships with government and worked in investing through government. So not just coming in and delivering standalone projects as an NGO, but advocating based on those successes for government to allocate dedicated resources, dedicated funding streams to develop strategies and policy frameworks that are then built into their national health plans and prioritization. So investing in developing the relationships and then using those to really advocate for inclusion of eye health and embedding of eye health within existing national health plans and frameworks. And there's no one size fits all approach. We have common messages we can use. We have common themes, common challenges, tactics for advocacy that are often used in different settings. But I think, again, picking up on Brandon's comments before as well, we have to be ready to have feedback loops within these programs so that we can evaluate and adjust our approach, and also invest in resourcing these activities so that you've got local staff, local decision makers who have that depth of experience and are then able to really embed eye health and eye health activities within their work. Rather than having lots of overseas people coming in to kind of run workshops or do events. So trying to really I don't like the word capacity building because there's often lots of capacity. It's empowering existing capacities through resources, messages, in what are the ways we can support so that you've got that, you're developing that core eye care coalitions within countries. But we recognize it's an ongoing challenge for the NGO sector, and look forward to hearing if any of the other panelists have any advice on how we might resolve it.
Yes, and Dr. Jambi, I wonder whether you have actually any thoughts of how you push governments into that kind of leadership role and really take ownership of eye care.
Yes, for us, we've, as we mentioned, the government taking ownership in HR training of doctors and the mid-level eye care workers out there. We are encouraging the government, the health ministry, and the provincial health authorities to be able to employ their own doctors, so that then they can come in and I read all those program in association with the Divine Word University out of our province is also working with government to make sure that they're employing people that are already employed in their hospitals. They're bringing them in, training them, and sending them back there. So and supporting them as much as possible. In that way, they are also helping the government to train the manpower that they need on the ground. For consumables, we also advocated for the government through the area medical stores and pharmaceuticals to order in all the eye drops and the medicines that's needed for the country. So that we in 5 years ago we didn't have intraocular lenses and eye drops that are needed for cataract surgery and all that, but it's now happening. For infrastructure and all that as well, there's a new hospital system that's in place now through the provincial health authorities. So the provinces are now able to create their own budgets and be able to prioritize where the high health is a priority in that province or not will depend on everybody is sitting down and talking with each other to find out, yes, we've got eye problems here and we need to train our staff, we need to get the consumables in, and we need to have infrastructure for all that is happening. So slowly, the concept is happening on the ground in PNG.
Thank you, Dr. Jambi. And Brandon, I wonder if I could bring you back in here, because actually what Dr. Jambi has just mentioned speaks to one of the questions that we have, which is, there's still quite a lot of challenges that exist at the national level, particularly when it comes to human resources and infrastructure. So you have these kind of big, ambitious global commitments like the World Health Assembly resolution, but then actually when you get to the sort of national implementation and national advocacy, you're quite far behind in terms of the resources. So how do you account for that in your national advocacy approach?
Yeah, tough question. And again, I don't think there's a simple answer, but I think what we're sort of seeing unfold before our eyes here is that this sort of new agenda is coming with it a series of tools that the WHO is frantically trying to get out to be used at the country level. So I'll give you one example. So there is an updated eye care services assessment tool, the EXAT tool, which is trying to assess the situation in a country. and it will unpack the health system across workforce, across leadership and governance, and those sorts of things across the pillars. And it will do a number of different things to help you assess in real time how things are going. And I think what that tool will also do is give you a sense for where your strengths and weaknesses are. So that's just one tool where if you were to use that tool, you'll be able to find out, where could you make some inroads? Where are your strengths and where are you okay in your country, in your particular context, even at the subnational level? And then where are the areas that you need to prioritize because you sort of see that there are more challenges in those areas. So I think the agenda we've got before us is trying to create not just the sort of global motherhoody type statements and resolutions, but also to back that up with a series of tools to help implement at the country level.
Thanks, Brandon. A very good answer to a very tough question indeed. So I'd like to ask each of our panelists to give their elevator pitch. So I was going to say that you're trapped in an elevator with the president or the prime minister of your country, but actually, as we've learned from Caroline, it could be just about anyone that you're trapped in an elevator with, and they were all equally important. But you have sort of one or two sentences to convince them to prioritize and invest in eye health. While I give our panelists perhaps just a couple of minutes or seconds to think of something, we'd like to run our final poll, which we're going to use the chat function for. So can I ask everybody in the audience to write in the chat box the one thing you learned or will do differently after this session, and hopefully there is at least one thing. So I am going to pick on Jorg first, please, your elevator pitch.
Sorry, I was on mute there. So I typically start out by asking people when they have been to the ophthalmology last, because typically people tend to not go as regularly as they should actually go to the ophthalmologist. And then I say, see, this is what also happens with politics and eye and vision healthcare. You continuously overlook it, even though vision health actually affects every part of a person's life, be it from the very beginning to your schooling success, to your success during your professional life, and when you age, vision is an important part, and that's why politicians and politics need to actually include this in their overall approach.
Thank you, Jorg. And Elise, your one sentence.
Well, similarly, I think addressing blindness, vision impairment, and improving eye health is absolutely transformative to people's lives. Vision is our most valued sense, and we have simple, low-cost solutions to improve it. Investing in eye health provides an important and critical opportunity to achieve universal health coverage and advance the Sustainable Development Goals, while also improving the lives of millions of your citizens around the world.
Great, thank you, Elise. And Dr. Jambi, your one sentence.
I've actually got two sentences.
I'll give you two sentences then, Dr.
Well,
Jambi.
for Papua New Guinea, I think the IL sector has proven to be okay. Yeah, I think the IL sector has proven to be the well-organized section with all the stakeholders working together in collaboration with each other, complementing each other, and so far we've been able to deliver important projects and activities that are addressing and impacting our people. And then, like during this pandemic, we know that priorities of the government has shifted, but in the next 5 years, I think we've got all our plans ready, and we will, slowly but surely get to where we want to get it, and that's like addressing the cataract blindness, refractive errors, and vouching for the Center of Excellence, and also planning to achieve to have an optometry school within the university. So we're there, but surely get to where we want to be.
Thank you, Dr. Jambi. And Brandon.
If you live long enough, everyone will have an eye health condition. Eye health simply works. It is cost effective and transforms lives. I think that's 2 sentences.
Perfect. Thank you, Brandon. And I'm seeing lots of great comments in the chat about how people are going to change. Lots of messages around collaboration and coordinated advocacy, and that every person matters, which I think is something that's really come through in what Caroline said. So that's really great to see. I think that brings today's session to a close. I'd really like to thank all of our speakers and panelists for all their advice and insight today. As we said, this is just the very start of the conversation on the new global agenda for eye health. Our next session will be a workshop on evidence-based advocacy on Tuesday, the 4th of May. We're going to be looking at the use of data and evidence and how to use that most effectively for eye health advocacy. And we'll be joined by the Vision Loss Expert Group and the Lancet Global Health Commission. So please make sure you register for that session. All of the information and the materials for the Advocacy to Action series is available on our website, and you can look at this recording and also the full interview with Caroline on the website too. So just thank you to all of our speakers, and thank you to our wonderful audience as well today.